Hello everybody, I welcome you all to Healthy Living with Regina Tetteh, where it is all about health promotion. So last week we began a topic on contraception, and it's going to be on episodes because it's actually broad if I want you to understand everything properly. Okay, so are you this beautiful young lady within the reproductive age group? Are you sexually active yet you aren't ready to make babies, and so you're looking for ways and means to prevent pregnancy? And do you also not prefer a hormonal method or a surgical method due to personal or medical reasons? Then this particular video is for you. So I'm going to share with you the natural ways of avoiding pregnancy, the natural ways of intentionally preventing pregnancy even though you are having sex. Kindly stay tuned. I will be right back. I welcome you all back to my channel. So then, what is this method in question that I am talking about? This method in question is the fertility awareness based method. Okay, so you may ask yourself, what is this method? Like the name says, fertility awareness based. So in this method you are looking at the days during which you are fertile, and then you avoid sex on those days. Okay, so how then does this work? What mechanism does it rely on? Okay, so this method of contraception relies on the physiology of your body, okay, the physiology of the menstrual cycle, and then the lifespan of either the sperm or the egg. Okay, that's your egg that you release monthly in your cycle. Okay, so it is known that the sperm, the normal sperm, does not live beyond 5 days. Okay, and then the egg does not live beyond 24 hours. Okay, so it's based on this physiology that the fertility awareness based method calculations is done. Okay, it's just some simple mathematics. Okay, all right. What does this method involve? It involves knowing your fertile days by assessing your menstrual cycle length. Okay, so you assess your menstrual cycle length and get to know which days you are fertile, which days you are not, so that you have sex on days on which you are not fertile. Okay, so it's either this, or you assess certain signs that comes with ovulation. What does this sign involve? It could involve cervical secretions or your basal body temperature. Okay, so all the methods under fertility awareness based methods that we are going to talk about is going to be based on either of these two, either fertile days of your menstrual cycle or you observing signs of ovulations. Okay, so based on these two things, we have 6 methods under the fertility awareness based methods. This includes the calendar reading method, the basal body temperature method, we have the standard days method, and then we have the ovulation method, we have the 2-day method, and then we have the symptothermal methods. So these are 6 methods, all of which are part of the fertility awareness based methods. You could use either of these to prevent pregnancy in a natural way, okay, without taking pills, without undergoing surgery. Okay, we are going to take each of this one by one. We're going to talk about what they are, how to use them, how they work, how effective they are, the advantages and the disadvantages. But before we go to either of these methods, let me give you a brief overview of how the ovulation works and how the secretion works when it comes to our physiology. Okay, research has shown that a woman is fertile 5 days before ovulation and 24 hours after ovulation. Okay, but the fertility rates, the fertility effectiveness varies depending on the days. Okay, what do I mean by this? The percentage at which a woman is fertile 5 days before ovulation is 4%. Okay, so it means that 5 days before the day of your ovulation, if you should have sex, the chance, the likelihood of you getting pregnant is 4%. Okay, that's not much of a percentage, although you could be one of those people in this 4%, so you still have to be careful. Okay, and then when we come to 2 days before the day of ovulation, the percentage is 25 to 28%. Okay, so you can see that the percentage of fertility when it comes to a woman actually having sex 2 days before her ovulation compared to that of 5 days before ovulation is high. Okay, so the likelihood of you getting pregnant 2 days before your ovulation compared to the likelihood of you getting pregnant 5 days before your ovulation is high. Okay, so if you want to get pregnant, then you could use this to your advantage to get pregnant. But since you don't want to get pregnant, it means you avoid sex on these days. You avoid sex 5 days before ovulation. You avoid sex 2 days before ovulation. Okay, I hope you're getting it. The percentage, however, reduces to 8 to 10% during 24 hours after ovulation. Remember, I said the egg, after it has been released, can survive for 24 hours. Okay, so yes, during the 24 hours, it could actually get fertilized if you have unprotected sex. Okay, but the percentage is between 8 to 10%. After 24 hours, the percentage reduces to 0%. Okay, looking at all we've spoken about so far, we would actually note that a woman has 6 days fertile window period to get pregnant. So it means you need to avoid sex during these days. Okay, all right. So let me also quickly add that everyone's physiology may be different. Okay, that's why we have ranges. Okay, what works in my body may be different from what works in your body. It's actually different. Okay, because I am different and you are different, my genes are different from yours and all of that. A majority of cycles between 26 to 32 days. Okay, so if your cycle falls within these days, either your cycle is a 26-day cycle, 27, 28, 29, 30, 31, 32-day cycle. In majority of such cycles, ovulation occurs very close to the midpoint. What do I mean by this? If you have my pen here, I have a paper here. Okay, so if you pick, let me say your cycle is 26 days. So if you pick 26 days, okay, 26 days, the midpoint of this is going to be what? 26 divided by 2, which is what? 13. Okay, so with the 13, from what I've just said, it means if you have a 26-day cycle, then your ovulation occurs close to this day 13 of the cycle. I hope you are getting it. Okay, however, in 30% of cycles, ovulation occurs at the midpoint. Ovulation occurs at the midpoint of the cycle. So still on the 26-day individual, if you pick 26 divided by 2, which gives us 13, it means in 30% of individuals with this cycle, ovulation occurs exactly on the 13th day. Okay, and then in some 95% of individuals with, yes, again, cycles between 26 to 32 days, ovulation occurs 4 days before or after the midpoint. Okay, the cervical secretions occurs when estradiol has been released by your developing follicle. Okay, so this estradiol causes the cervix to release secretions. Okay, so that if you should have sex during this period, these secretions will enable the sperm to swim better through your uterus, through your fallopian tube, and then to reach the egg that you have ovulated. Okay, so it means if you should have sex during the time where this cervical secretions is being secreted, your chance of getting pregnant is high. So then we want the opposite, right? So it means we would have to avoid sex during the secretion of this cervical fluid. I hope you get it. After ovulation, this cervical secretion thickens as a result of the presence of progesterone thickens the secretion, and the thickening of this secretion makes it difficult, okay, for sperm to be able to swim to the egg. And as a result of that, if you should have unprotected sex during this period, your likelihood of getting pregnant is low. Okay, that is why some people observe the texture of the cervical secretion to know whether they are safe to have unprotected sex or not. I hope you are getting it.